Set 24 Statistical Analysis Plant Technical Question and Answers. Answers are highlighted in green. Question 1. In a phase 3 oncology trial, the primary endpoint is progression-free survival (PFS). The SAP specifies that Kaplan-Meier curves will be used for estimation. What additional statistical test is typically used to compare progression-free survival between treatment groups? Now here the option A says students t-test. Now this test is used to compare, like say for example, if there are two samples, whether you want to compare the mean or the standard deviation between two variables, whether they are equal or they are unequal, irrespective of number of records, right? Now, so this is not the right answer. Now, Fisher's exact test is used for the 2x2 contingency table, if you remember. So this is not the right answer. Even the chi-square test is used for a 2x2 contingency table. So this is not the right answer. Now here the reason is we are having Kaplan-Meier curves. So it's but obvious that you will have the number of time points and you will have the progression-free survival, the estimation of how the patient have survived, right? So these three options are not correct. So the correct answer is log rank test, which is typically used to compare progression-free survival between two treatment groups. Question 2. A clinical trial for a new diabetes drug includes an interim analysis for efficacy. The statistical analysis plan states that an O-bearing Fleming boundary will be used to control type 1 error. What does this mean in practical terms? Now the option B says the study will be stopped early if the drug shows any benefit. Now even if the drug or the medicine, if it's showing any benefit, you cannot stop the clinical trial, right? It doesn't make sense. So that is not ethically allowed. So B is not the right answer. The study will continue even if the early results show strong efficacy. Now this is okay, like even if the study is showing strong efficacy or even if it is showing any weak efficacy also, the clinical trial has to continue and get completed, and only then the results can be seen. So this is not the right answer. Now all p-values will be adjusted using Bonferroni correction. No, this is not the right answer. All p-values related to any parameters like say primary, secondary, exploratory endpoints, you cannot adjust everything, all p-values, because the statistical test will be different, right? So you cannot adjust like this. The assumptions cannot be same for all the hypotheses. So the only option remains is option A. So the correct answer is A. A stricter alpha level will be used for early analysis to reduce false positives. So the correct answer is A. Question 3. A cardiovascular trial includes both per protocol PP and intent to treat ITT analysis as per the SAP. Which of the following best describes the difference between these two populations? Now option A says ITT includes only those patients who completed the study as planned, while PP includes all randomized patients. Now this particular option is vice versa, so this is not the right answer. Option C says ITT and PP populations are always identical in any clinical trial. No, these two populations are not same. They differ in their definitions and they differ in their flags. So this is not the right answer. PP analysis is always preferred over ITT in regulatory submissions. No, it's not necessary that you have to submit all the analysis by PP only, then ITT and safety is not considered. No, that is not mandatory and that's not preferred kind of analysis, especially in regulatory submission. So this is the not the right answer. So the only option remains is B, which is ITT includes all randomized patients while PP includes only those who strictly adhere to the treatment. So the correct answer is B. Question 4. The SAP foreign vaccine trial specifies that adverse events will be analyzed using relative risk RR and confidence interval. What does a relative risk of 1.2 with a 95% confidence interval of 0.9 and 1.5 indicate? So the option A says the vaccine significantly increases the risk of adverse events. No. Now remember one thing, the relative risk 1.2, it is in between 0.1 and 1.5. So it is lying in between, right? It is within the confidence interval. So it has neither increased or neither decreased, and the vaccine has completely prevents adverse events. So this is also not the right answer, because if the relative risk, right, if it is to the left or to the right, then it can increase or decrease the risk of adverse event. So these three are not the options. So the correct answer is there is no statistical significant difference in adverse event risk. Why? Because 1.2 is lying between the confidence interval 0.9 and 1.5. So any value or any relative risk is between the lower limit and the upper limit, you come to a conclusion that there is no statistically significant difference in adverse event risk. So this is much you should understand. If it is lying below the lower limit and if it is lying above the upper limit, then there is a significant difference in the adverse event risk. So here the correct answer is C. Question 5. In statistical analysis plan, the handling of missing data is critical. If the trial uses a multiple imputation MI method, what assumption does it generally rely on? So option A says missing not at random. No. Missing completely at random. No. No missing data are allowed in MI. No. So the correct answer is C, which is missing at random. So all those data which has been missing, so those assumption we use MAR. So the correct answer is C. Question 6. A clinical trial includes a hierarchical testing procedure for multiple secondary endpoints. According to the SAP, what is the primary reason for this approach? Option A, to ensure all endpoints are treated equally in the statistical testing. No, you cannot, equally uh, treat all the endpoints. So because each endpoint is different, their testings are different and their assumptions and their lower limit or equal to, not equal to, inferior, superior, so that is different, right? So you cannot treat all them equally. Then option C says to allow post hoc changes to endpoint rankings. No. To increase the type 1 error rate for secondary endpoints. No. So this is not the right answer. So the correct answer is to control the family wise error rate while maintaining power. So correct answer is B. Question 7. A clinical trial is analyzing overall survival OS as a time to event outcome. The statistical analysis plan mentions using Cox proportional hazards regression. What key assumption must be checked for this model? Option B, the survival curves must be identical between groups. No, it is not necessary. Survival curves will be different. They cannot be same. If it is same, then what are we testing? So this is not the right answer. The treatment effect must be normally distributed. It's not necessary. So this is not the right answer. The sample size must be greater than 1,000 subjects. Now this is immaterial. Even if the sample size is less than 1,000 or if it is even 100 or 200 patients, that does not mean you don't analyze OS as a time to event outcome. So this is not the right answer. It is not dependent on the sample size number. to use OS as a time to event outcome, right? So the correct answer is the hazard ratios must remain constant over time. So this is the assumption that we ensure that it should be checked for this model. Question 8. The statistical analysis plan of a clinical trial specifies a sensitivity analysis using a tipping point approach. What is the main purpose of this analysis? Option A, to determine the exact point where the treatment becomes harmful. No. To find the optimal dose for the drug. No. To adjust for the multiple comparisons. No. The correct answer is to assess the robustness of the primary endpoint to missing data assumptions. So sensitivity is generally used where you have missing data, and how are you going to handle missing data. So what all kind of stuffs that you will be using, right? So all those things comes under the primary endpoint. Question 9. In statistical analysis planned, subgroup analysis are planned for age and gender. What is the most important consideration when interpreting the results of these analysis? Option A. Subgroup results should always be considered as primary findings. Need not be necessary. It's not mandatory that the subgroup or the strata results that should be considered as primary. It is irrelevant. So this is not kind of mandatory kind of stuff. Option C, subgroup analysis should always lead to changes in trial conclusions. It may not be necessary. Like say for example, even if you do the subgroup analysis, you will not see any changes in the trial conclusions. The results and the effects and the significant difference will remain the same. You will not see any major changes. So it is not always necessary. No adjustment for multiple comparisons is needed in subgroup analysis. No. So the correct answer is subgroup results should be interpreted cautiously due to the risk of spurious findings. So the correct answer is B. So now what happens is whenever you have any subgroup which is related to age or gender, so whenever you are interpreting the results, you should ensure that whatever findings which are there, those should be appropriate. There should not be any mistake, and it should always be done very effectively, and it should be checked each and every value, because whenever you are considering the subgroup age, you will have the numbers in like say numerical values, right? So first of all you need to convert into categorical, like say for example 18 to 25, then 26 to 30. So those kind of categorical variables that you will need to first perform, and only those records which they fall, only then the subgroup analysis can be done. Question 10. The SAP for a clinical trial includes a non-inferiority analysis. The non-inferiority margin is set as 5%. What does this mean? Option A, the new treatment must be at least 5% more effective than the control. No. The option C, the new treatment must have exactly the same efficacy as the control. Now, if the new treatment is having the same efficacy as the control, then what is it that we are testing and what is it that we are checking? So this is not the right answer. Option D says the new treatment must have a p-value of less than 0.05. It may not be necessary. So this is not the right answer. It does not mean that p-value is less than 0.05. So the correct answer is B, which says the new treatment can be up to 5% worse than the control and still be considered as non-inferior. Now, just to explain this in a very common layman's language is 5% error or 5% bad kind of situation can happen as compared to the control, so that much is allowed. Like say for example, how to explain this, like say a particular student is there, he is trying to make an attempt in giving an exam, right? So out of 10 questions, one question is allowed to have the wrong answer, right? But you should ensure that you should give all the answers, 9%, all the 9 questions, your answers should be correct. So 1% chance of having wrong is allowed, but not more than one or more than two questions is allowed to be wrong. So in that situation, the new treatment, whatever is there for a specific disease, it can have, it can go worse up to 5%, wrong can be allowed, but not more than that. So this is the meaning of this margin is set to 5%. Please like, share, and subscribe. Leave a feedback comment mentioning any topic that you want me to make a video. Looking forward for a positive response. Thanks for watching. Please like, share, and subscribe. Leave a feedback comment. Many thanks for your support and having great connection.